Hello, good morning. How are you?
I'm good. My name is Mandeep Singh. I'm originally from Chandigarh but based in UK from the last 7 years.
Okay.
I've been suffering from gradual hair loss since 2006 and I've tried different options such as topical treatments and some Ayurvedic treatments, but none of them seem to work. So then finally I basically got recommendation of Dr.Suneet from my aunt, who herself is a doctor in Ludhiana, and then I decided to go for hair transplant. So I came here yesterday and I was explained all the procedure in great detail, the different techniques which are used for hair transplant, and then I decided to go for the strip method. And
You have seen the results?
I've seen the results, I've seen your website, and
Have you met few patients?
I've met few patients yesterday in your clinic and they all were quite pleased with the results and the retention rate. So that is why I thought I'll go ahead and go ahead with the procedure. So I just hope for the best, and here I am for our pre-op this morning.
So it's the early morning and we are planning just for the hair transplant in your frontal area. This is a quite large area. This is the area where we are going to plant the hairs today, and we have planted the strip from the back side. You can see the strip has been marked on the back side. These are the strip line from which we are going to take the hairs. Fine.
Sure.
And just we are going to give local anesthesia on our back side, and then we take out the strip.
Okay.
Fine.
That's great.
Just in a few minutes we will give the local anesthesia. The things will be numb, and we'll start the procedure. Okay.
Okay.
Best of luck.
Yeah. Thank you. A little bit stressed.
So local anesthesia has been given on the back side. How do you feel?
Yeah, I just feel a little bit stressed. I feel as if there's like a.
How much amount of pain you felt?
Well, there wasn't much pain. It was just like small needle pricks.
Okay.
But slowly, as the local anesthetic took effect.
And now the back is numb.
Yeah, the
isn't it?
back is numb. Yeah.
Okay. How painful was the procedure of taking the strip from the back side?
Okay, it wasn't painful at all. The only thing was that once the local anesthetic is injected, we just feel some fine needle pricks. And once the numbness sets in, then you don't feel anything at all.
So you mean to say it was almost painless?
Yeah, it was almost painless.
And there is no scar on the back side, which is visible at present also. There is very fine line.
Yes,
Fine.
that's true. Yes,
And
that
it
is
will
correct.
most probably it will finish. How are you?
I'm good.
The procedure which I have done till now is number of slits. Can we show the
Yeah,
punches?
Sure.
Around 4,000 small holes have been made on your scalp.
Yeah.
Does it bleed or do you feel any pain?
No, there's no pain at all.
How do you feel now?
I feel good.
You have taken a breakfast in between?
Yes, I've just had my breakfast.
Okay. Thank you.
Yes, I'm good. Thank you.
You want to see your own hairs being
Yes.
cutted down? Just
Yes.
come. So this is our cutting chamber.
Okay.
Fine. There are around 8 to 10 people who sit here and cut your own grafts.
Right.
Fine. So these are the imported microscopes under which they are cutting. His Bridgman kya hai? So he is dividing your hairs.
Yes.
He is making the slivers. Just show the strip to him. Atatan. So he is dividing your hairs. You want to see your hairs?
Yes.
Yes. Bridgman हटना जरा एक स्लीवर रख के दिखाना. Fine.
Yes.
So these people are dividing your hairs further, and you can see these are keeping your hairs in bunches of 50 hairs like this. Fine.
Yes.
They are kept in normal line so that they don't dry up.
Yes.
So everybody is doing the same job. precisely without damaging your hairs.
Okay. That's very good.
Fine?
Yeah, I'm happy.
Happy? Okay. How are you, Mandeep?
I'm okay.
Okay, the planting is going on. Are you comfortable?
Very comfortable.
Okay. So we are using loop magnification, that is 4x magnification for plantation, to have a very precise planting without damaging the hairs. Fine. Have you had your lunch in between?
Yes, I had my lunch, I had my breakfast. So
Okay.
I've just been lying down virtually painless for the whole day.
Very good, very good. You had a coffee?
Yeah, I had a coffee.
You want something more?
No, I'm good. Thank you very much.
Thank you. How are you?
Great, thanks.
Okay. So the procedure has been complete almost, and let me see the top page.
Yeah.
Yeah. So you planted more than around 4,500 grafts in you. How does it feel like?
Well, it feels quite good because I can see that it's quite thick and there's a lot of density.
Okay.
Obviously, we have to kind of wait and see for the next couple of months to see how it comes up. But at the moment, it really looks quite promising.
Okay. Thank you. Okay, Mandeep, how are you?
I'm good.
Good evening. How's the procedure whole day?
Procedure was good. It was fine. Virtually pain-free. Obviously, a bit lengthy. It took about 12 hours. So I was lying down the whole day and.
In between there were rests?
Yeah, in between, obviously, I had my coffee, I had my breakfast, I had my lunch, I could cook.
What about the pain? How's the total pain?
There's not much pain, there's no pain, virtually it's pain-free.
Okay, you are comfortable.
Yeah.
This is the headband which you have to wear for next 5-7 days to avoid swelling on your face. That's all. Fine, you can wash your head tomorrow morning.
Okay.
Or day after tomorrow morning.
That's fine.
Fine?
Thank you.
Hello Mandeep, how are you?
I'm good, thank you.
So this is the second day post-operative after your hair transplant. How do you feel like that after 48 hours?
It's absolutely fine. It's virtually pain-free. It just seems very normal to me. I was explained how to wash my hair and everything, and I think it's just normal.
So these hair are actually well settled, and you can see they are really clean and settled hair now. You can wash them daily now, and without any problem. This is the headband you have to